there. So it looks like you're here for a introductory Botox appointment. Is this correct? Okay, excellent. So you've never received Botox before? No, never. I can tell. Yeah. Here, lift your eyebrows up for me, please. Like this. Yeah, totally. Yeah. You have the capacity to do so, which reflects virginal muscles in your face. We're going to change that. Now, before we begin, are you aware of the side effects and the potential of Botox? Okay, good. Learning about the side effects is not important. There are some, but people like to overblow it. People who don't get paid to administer Botox. But the potential of Botox is what we're really going to focus on in this session. So, Botox, I'm going to apply a couple of gloves for sanitation reasons. Botox has the potential to alleviate headaches. It also has the potential to alleviate TMJ or TMJ. So sorry, my lips sometimes cannot pronounce the correct letter. It also has the potential to do small cosmetic corrections, such as lifting up the nose tip. So instead of getting an invasive nasal tip treatment, such as like a nose job, which I can do at my clinic as well, instead we could just administer a couple of little injections around the tip of your nose, and it'll lift it up very nice, very pointy. Likewise, we can correct some of the finer lines and some of the loosening or sagging muscles, of course, from your face. We can also administer a couple of dosages around your jawline to just tighten it up, especially if you're struggling with some sagginess. So, now that we've covered the potential for Botox, I am just going to check how much time you blocked off for our session today. It is a very relaxing session. A lot of my patients find that Botox makes them feel like they're at a spa. It's something that gives them a sense of personal attention. It's a almost therapeutic process for them. So, you have about 30 minutes blocked off, which is perfect timing. Within 30 minutes, we can get as many vials applied to your face as you'd like, of course, fully consensual. To give you a breakdown as to how exactly we are going to navigate this session, I am first and foremost going to be giving your face a little bit of a scrub down. As I scrub your face, I am just going to notice what parts of your face are a little dragged, fine-lined, marked. I'm going to take special note of your crow's feet, nasopharyngeal creases, and just check if there's any sort of angry lines, sad lines. You can also receive some discoloration around the eyes based off of crying, so I would highly recommend not doing that anymore. Likewise, I will be taking this very important tool and acupressuring your face just to tell which spots need a little bit more attention, Botox-wise. Lastly, after those processes are done, I will be using my tiny little magnifying glass here just to give a good little check around and see if there's any smaller lines that we might want to pay particular attention to. And if there are some small particular lines that you would like to give just a little bit attention to, then I will be collecting my Botox and my vial, dipping it into the fluids, and applying several vials into your face as needed. Before we begin, I will be checking your pulse just to make sure that you are a healthy candidate for Botox. also be giving you some complimentary for a price laughing gas. I find that this makes my patients very, very good. How does that sound? Perfect, perfect, perfect. I love it. I will also be marking up your face and telling you to emote certain expressions, so that way I can also get a better gauge as to some of the hidden wrinkles on your face and really just fine tune into them. Okay? Okay, perfect. Well, in that case, let us begin. I am first and foremost going to do my job as a doctor, a healer. Although, what is a doctor if not just a Frankenstein? At least I'm honest about my profession, which is actually quite noble of me. I'm just going to ask you to take a deep breath in for me, please. Just take a deep breath in. Perfect. And out. Okay, good. Another deep breath in for me. And out. Okay, good. I'm going to go towards the back now. Just to take a deep breath in for me. Good. And out. Okay. Take a deep breath in for me. Very good. And out. Perfect. Excellent. Okay. Fantastic. Now I am going to be setting aside my stethoscope and applying a little bit of laughing gas to your face. Have you ever been under the influence of laughing gas? I've heard, and I've also used it myself. It is a spectacular experience. You're going to feel very cosmically in tune. You are going to feel like every little injection that I place on your face, it's like a warm little kiss on your skin. It's very, very electrifying. It feels like every vial is a radiating experience on your face. Are you ready? Okay, so good. I'm just going to apply a little bit of laughing gas. Breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. Would you like a little more? I'll give you 4 more pumps. So breathe in. Good. And out. Breathe in. Good. And out. Good. Good. Breathe in. And out. Very good. And in. Very good. And out. Good. 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 Perfect. I'm going to lay this to the side. If you would like any more, please don't hesitate to ask. I will use my best judgment to limit the amount you're exposed to, but frankly, considering how this is your first session, I really just want to pamper you and make you feel nice and attended to. Okay. So now I'm going to be brushing your face. And as I brush your face, I am going to just ask you to keep your face nice and relaxed. As I brush your face, I will be noting down where I see some lines. I will be marking these lines on your face to indicate to me where some of the vials should go. Okay? Okay, so stay still for me. Relax as best as you can. Let the corners of your mouth just drop. Let your nostrils just relax, not flared nor sucked in, but just relaxed. Allow the corners of your eyes and your eyelids to just feel nice and heavy, and close if they'd like, or just remain somewhat parted. Allow your eyebrows to remain expressionless. Beautiful.
some wrinkles emerge. I'm also noticing some orange chin emerge when I brush your chin here. This can also be resolved with a little bit of Botox. I could just apply a couple of bottles down here. Just going to notice a little bit more over here. And over here. Okay. And up here. Okay.
Yep. Okay, I'm going to take my fun little pen and I'm just going to highlight exactly where I noticed some of the lines emerge on your face. Okay, on your chin, I noticed some dimples and discoloration. This can be remedied with a little bit of Botox. And then on your forehead, I also noticed a little bit of discoloration. This too can also be remedied with a little bit of Botox. I'm also going to apply a little bit to your temple here and a little bit to your temple right here. Okay. Let me note down how many vials will be needed in that respect. Going to be applying about 4 vials so far onto your chin, 2 chin, and then 2 vials per temple. Excellent. And then just 3 vials to forehead. Okay, perfect. Now I'm going to be pressing down on some of your acupressure points. So permit me one moment. I'm just going to go in and make sure that all of your spots are nice and aligned, okay? Okay, good. So I'm just going to go in and just see if that relaxes some of your muscles. This is just to test which of your muscles are prematurely sagging right now. Just gonna look at your temples again and see if there's anything there. And then on the other side, anything over here. Botox will freeze the muscle, making it nice, firm, and frozen. Or strengthened again. I'm gonna go beneath your eyes now. Now, because it will freeze your muscle and it'll make it far more firm, I want to tighten the sagging muscles. There we go. I'm noticing some sagging on your cheek already, some premature sagging. I'm going to look at your nasobonial creases. Yep. You're going to need a couple in your nasobonial creases. These are a bit premature for your age. So I'm going to put some there. I'm going to look at your nasal tip real quick underneath your nose. Just right here. On your philtrum. Good. And then on the tip of your nose. Okay, good. And then on the bottom. Okay, good. Okay. I'm going to pause from the acupressure for just a moment. I'm going to slip my thumbs underneath your lips, feel out the nasobonial lines, see where the muscles lie. Okay, so give me one moment. I'm just going to feel your nasobonial creases from inside of your mouth. Give you a nice little mouth massage. Interesting. Very interesting. Okay. I see
any, let's see. Okay. Yep, we're gonna need a couple there too. Okay. And now I'm going to go to the corners of your mouth and see what exactly needs to be done there too. Okay. So I'm gonna go down here, around your chin. See if there's any sagging muscles. Okay. And over here, I'm just gonna see if there's any sagging muscles. Sorry. I'm receiving a call, but it is not important. There we go. Scammers per usual. Okay, good. I'm going to probably apply some files there and there. And I think just to address some of the headache that I might be seeing on your ears, I'm going to just look at your ears real quick. I can tell that you're struggling with some headaches just from what I observed in your eyes. You have some very pronounced veins in your eyes, some tiredness, some bags underneath your eyes. So, a vial applied to your ear and to your other ear will certainly alleviate these headaches. So, I'm going to note that down as well. Just going to give me one more moment. I'm going to apply 2 vials to the sides of your chin. So 2 vials, 2 sides of the chin. And then 2 vials per nasoponial crease. So 2 vials per nasoponial crease. 2 vials per ears. 2 vials per ear. And then just 1 vial there, 1 vial there underneath your eyes. So 1 vial underneath eyes. Okay, give me one more moment. Let me just log these details into my system. Okay, perfect. Now I'm going to take this magnifying glass and examine the lines I see on your face. If you wouldn't mind following my instructions, that would be greatly appreciated. Okay, perfect. I want you to just lift up your eyebrows for me, please. Lift them up high. Okay, good. I'm going to just keep looking here. Examining your forehead. Okay. I'm going to use my pen to mark whatever lines I see here. Okay, good. Okay, good. And then there. Okay. Relax. Okay, good. Give me an angry face. Okay. Relax your face. Angry face again. Okay, good. And relax your face. Just going to go in. Okay, good. Now just give me a pouting face. Sad face. Good, good. Okay. Keep the pouting face. Keep the sad face. Okay. Relax your face. Good. Okay. I'm just going to mark up the lines that I see here. Okay. Now just narrow your eyes for me. Okay, good. I'm just going to look at your crow's feet. See what I can observe from your crow's feet. Okay. And then on the other side, see what I can observe from your crow's feet right here. Okay, good. Perfect. Now relax. Okay. Good. Now, I'm going to make a note of that. So we're going to be applying 2 vials per your crow's feet. Per crow's feet. And then 2 vials to the top corners of your mouth. 2 vials per top corner of mouth. And then just a couple more vials to the in-between portions of your brows. So about 3 vials between your brows, 3 vials between your brows, and then we're going to apply just 4 vials in total to the sides of your head. So 2 each. So 2 vials per side of your head. Perfect. Okay. So in total, we are going to be applying 6, 9, 11, 13, 15, 16, 18, 20, 25 vials of Botox to your face in total. Are you ready? You're gonna find that this is gonna be so relaxing. So to begin, we're going to begin with 4 vials to your chin. This is to correct the discoloration and the little bumps that we see here. Okay, so I'm just going to 1, get good, 2, good, okay, good, 3, good, and 4, good. Okay. Now we're going to be applying 2 vials to the sides of your temple. Okay. So relax for me. Okay, good. Okay, relax for me. There we go. Very good. Relax. Good. Very good. Now for the other side, relax for me. Okay, good. Relax for me. Okay, good. Now we're going to be applying 3 vials in a vertical line down your forehead per each line I saw, so just relax. Very good. Relax. Very good. Relax. Very good. Okay. Now we're going to be applying 2 vials to the sides of your chin. So stay still, relax. There we go. And relax. Beautiful, beautiful. You have such a beautiful face. I'm so privileged to be able to enhance it. Relax. Beautiful. Yes, I mean, if you'd like, I would definitely recommend seeing me in about 3 months just to get all of these treatments redone, just because that's when the Botox fades, 3 to 6 months typically. Now I'm going to be applying 2 vials to each side of your nasogenial creases. So stay still for me. Relax. Just keep your lips nice and just relaxed. Perfect. Okay. One more on this side. Relax. Beautiful. And on the other side, relax. Beautiful. And relax. Okay. Beautiful. Now I'm going to be applying 2 vials to each side of your ear. Okay, so just relax. Keep your ears nice and heavy. Beautiful. And beautiful. And now the other ear, just relax. Okay, beautiful. And then relax. Beautiful. Now I'm going to be applying one vial underneath the tip of your nose. So I'm just going to go right here. Relax. Perfect. And now 2 vials per your crow's feet. So right here and here, here and here. Okay. Relax. Beautiful. Okay. And one more on this side. Relax. Beautiful. And okay, beautiful. And over here, relax. Okay, beautiful. Excellent. And just there we go. One more. Relax. Beautiful. And now 2 vials for the top corners of your mouth, right here and here. Not on your nasogenial crease, but just to kind of tighten and firm up your lips. You can't even notice it going in now, can you? That's how relaxing the experience is. It's supposed to just sort of radiate a sort of warmth into your face. It's almost just really enjoyable. It's a very pleasurable experience. And then 3 vials around your forehead. So I'm just going to apply there, 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 perfect, there, good, there, good, and there, good. And then 2 vials per above between your brows. So I'm just going to apply one right there. Okay, good, and one more right there. Okay, perfect. Beautiful, beautiful. How are you feeling? I'm glad. I'm going to just clean up your face a little bit. I'm just going to clean this up. Okay, you are all set. Botox is a very quick experience. Like, once we're in and it's all injected into your face, you can just as quickly leave. Now, I would, as I previously mentioned, recommend visiting me again roughly in about 3 to 6 months. That's when you're going to notice a lot of your muscles begin to drop and sag and relax. And that's when you're going to want to get a little bit of a touch-up. Okay? Yeah. So for now, you just owe $800. Will that be cash or charge? Cash. I'll take that. Thank you. Put that right here. Perfect. Thank you for visiting my little clinic, and I cannot wait to see you again. Take care.